My name is Dr. Simone Elder. I'm a reproductive endocrinologist.
I decided to join Reproductive Medicine Associates for several reasons. Number one, they're focused on research and evidence-based medicine. Not every patient is the same, and RMA definitely takes that into consideration. I grew up in the South. I was born in North Carolina, and then I moved to Georgia when I was in my tweens. And then I went to Texas for college. In my last year of college, I actually got a fellowship to go abroad through the Gates Foundation. I studied public health in India, China, South Africa, and France. And in that year abroad, I realized I had a passion for women's health. I went to Cornell for medical school in New York City. And then I stayed at NewYork-Presbyterian Cornell for residency in OBGYN. I actually didn't know about reproductive medicine as a potential career option until I went to medical school. They taught us about conception, how embryos are formed, how babies are formed in the pregnancy process. And most importantly, they talked about what they do from day to day, including helping individuals make the family of their dreams. Something that I really enjoy about the field of reproductive endocrinology or fertility medicine is that we are constantly coming up with
New technologies that are advancing our field.
We have new research and new technologies that keep advancing the field constantly. AI-driven research can actually help us improve embryo selection, for example. So there's always hope for our patients. One myth I hear is that a lot of infertility is female-driven, but in actuality, 40% of infertility is male factor, and then 40% are female factor, 10% are both, and then 10% are unexplained. IVF isn't the only option we have for infertility treatment. We can do some other treatments prior to proceeding with IVF. I'm definitely a doctor of evidence-based medicine, but with individualized patient care. So what works for one patient might not work for another. Infertility does not discriminate. I have patients of all different religious background, cultural background, gender identity, and being able to empathize with each and every one of them at an individual level is something that I really appreciate in fertility care. I like my patients to know that I'll be with them every step of the way, including being there with them during their disappointments, as well as celebrating all of their successes. I'm extremely blessed to be able to come to work every day with such hardworking, caring team members. The main focus for everyone here in the clinic is patient care, and I definitely see that in every aspect, from getting blood drawn to doing procedures to bringing the patient into my office for me to talk to them about next steps. All the team members are definitely focused on creating a good patient experience. I just want my patients to know that I'm definitely going to be their #1 cheerleader.